You and your doctor have decided that tamoxifen is the right medication to fit your specific needs. We want to help you to further understand the treatment that you'll be taking. However, first we need to understand the problem before we can identify the appropriate treatment. Now, breast cancer, like all cancers, can be difficult to explain and understand in a short video like this. So we'll just sum it up quickly in a 3-step process. It's initiation, promotion, and progression. It starts with initiation, which is a mutation in the DNA. Then in promotion, repeated exposure stimulates these mutated cells to grow and divide. And lastly, in progression, these cells acquire more mutations and become more resistant to your immune system, leading to a growing tumor. In your case, during promotion, estrogen, which is a natural hormone, acts as a helper for these cells to grow. This is where tamoxifen comes in. Tamoxifen is a selective estrogen receptor modulator, also known as SERM, which enters the cell and binds to estrogen receptors. This is like putting a child block on an outlet so that an electrical plug cannot fit in and no electricity can go out. The process looks a little something like this on a cellular level.
So here we have a just regular generic cell. It's got a few organelles and a nucleus. This is where your DNA is kept. We also have shown highlighted and bigger than usual some estrogen receptors. Now these are where estrogen comes into the cell and will bind to help the cell with normal functions in a healthy cell. Now, in cancerous cells, there is no way of stopping this estrogen from coming in. So, a bunch of estrogen is gonna flow into this cell, and it's just going to keep accepting it, making the cell grow and divide rapidly, making a tumor grow bigger and bigger. Now, the role of tamoxifen is to come in here and bind to these sites where the estrogen would normally come. It acts, as we said before, as a cap on the receptors. Where the estrogen would normally bind. Now, when estrogen tries to come in here, it gets stopped by the tamoxifen and bounces off. And therefore, the cell cannot grow and divide, and the cancer is stopped.
Cells go through several phases during mitosis, at which the cell stops and checks itself for any fixes that need to be made. Tamoxifen has been shown to significantly reduce the amount of cancerous cells from moving out of one of these stop periods. This means that the cell will not divide and the tumor cannot grow. Now that you know what's going on inside your cells when you take tamoxifen, let's discuss some of the medicine's technical properties. You will be taking tamoxifen orally once or twice daily at the same time every day. This means no trips to the hospital to sit in a chair and wait for an IV drip to put the medication into your system. Tamoxifen should be taken after surgery, radiation, and/or chemotherapy treatment. Tamoxifen can also be used to help prevent breast cancer in women and men more prone to the disease. In this case, you will most likely be taking tamoxifen over a period of 5 years. Sometimes tamoxifen can be prescribed to women who have had trouble becoming pregnant in the past to induce ovulation. Be sure to tell your doctor about any drugs, vitamins, and supplements that you are using or plan to use, as your doctor may need to change doses. Tell your doctor if you become pregnant or plan to become pregnant while taking this drug, and do not try to become pregnant or breastfeed while taking tamoxifen. You will still need to be checked for early signs of breast cancer, as it is still possible to develop breast cancer while using tamoxifen.
Tamoxifen may cause the following side effects. Talk to your doctor if any of these symptoms are severe or do not go away. Side effects include increased bone or tumor pain, pain or reddening around the tumor site, hot flashes, nausea, excessive tiredness, dizziness, depression, headache, thinning of hair, weight loss, stomach cramps, constipation, and loss of sexual desire or ability.
Some side effects can be very serious, and you must alert your doctor right away if you experience any of the following: vision problems, loss of appetite, yellowing of the skin or eyes, unusual bruising or bleeding, fever, blisters, rash, swelling of the eyes, face, lips, tongue, throat, hands, arms, feet, ankles, or lower legs, thirst, muscle weakness, or restlessness. Tamoxifen may cause cancer of the uterus, strokes, and blood clots in the lungs. These conditions may be serious or fatal. Tell your doctor if you have ever had a blood clot in the lungs or legs, a stroke, or a heart attack. Also tell your doctor if you smoke, if you have high blood pressure or diabetes, if your ability to move around during your waking hours is limited, or if you are taking blood thinners such as warfarin.
In addition to taking medication, you should also consider a healthy diet, stress-reducing activities such as yoga, getting at least 8 hours of sleep every night, and joining a support group. Studies have shown that strong social support, coupled with treatment, have been proven to increase outcomes, including remission. Talk with your doctor about the options available to you. We wish you strength in your journey, and remember that you are not in this alone.
With you, we could go up, then take that little ride. We'll sit there holding hands and everything will be just right. And maybe someday I'll